Greetings, fellow Rotarians and guests. My name is Joe Young, and it's my honor to serve as the 2020-2021 President of the Rotary Club of Columbus. Founded in 1915 with our first meeting in February of 1916, our club is one of the oldest and largest within Rotary International. Our membership includes a diverse set of leaders within business, city government, military affairs, healthcare, education, arts and culture, social services, and ministry, all sharing a common desire to improve our community and have a positive impact on the world around us. The world needs Rotary and the ideals that we represent now more than ever. The onset of the COVID-19 pandemic has dramatically changed the way we live, work, and interact with one another. School-aged children that were already struggling with food insecurity and educational development are falling further behind. Recent acts of violence perpetrated against our African-American brothers and sisters have further highlighted the fact that systemic racism continues to plague our nation. Political division and social unrest continue unabated. The world needs our leadership, and while these are extremely difficult challenges to overcome, Rotary is well positioned to be part of the solution. I long for the day when it will be safe for us to meet and fellowship again in person. Until then, please keep wearing your mask, please keep loving each other, and please keep serving others above yourselves. On behalf of my wife Vicki and our daughters Katie and Lynn, I want to thank you for all that you are doing to make our community a better place to live. It's my pleasure to serve alongside you. Now let's get to work. Greetings and welcome to the August 12th meeting of the Rotary Club of Columbus. Whether you're joining us as a member or a guest, we're glad to have you here. As we start today's meeting, I want to take a moment to offer condolences on behalf of our club to past President Cecil Cheeves and his family following the death of their grandson Lyle this past week. Cecil, we love you. We pray God's grace and love on you and your family during this very tragic time. Our pledge today is going to be brought to us by Hamilton Pezold, a son of Rotarian John Pezold and grandson of Rotarian Jack Pezold.
I pledge allegiance to the flag of the United States of America, to the republic which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you, Hamilton, for leading us in the pledge. It's our club's tradition each week to recognize an active duty soldier from Fort Benning. It's my pleasure to call on Rotarian Andy Redmond with this week's introduction.
President Joe, fellow Rotarians, it's my honor to introduce Sergeant First Class Randolph Adams. Sergeant Adams joined the Army from Chicago, actually started in the National Guard in 2004, joined the active duty Army in 2008. He's a field artilleryman. Here at Fort Benning, he's assigned to the 1st Security Force Assistance Brigade, whose mission is to deploy overseas and train foreign armies to help them establish their militaries. As you would expect from a soldier who's been in a long time, Sergeant Adams has a long list of awards and decorations, including the Army Commendation Medal with 4 oak leaf clusters, Army Achievement Medal with 4 oak leaf clusters, and a host of other awards. He's deployed twice to Afghanistan. Looking forward to leaving here to go be a leader in our Army. Currently slated to move to Germany, depending on how the force structure changes work in Germany. I may or may not go there, but he's looking forward to that. Sergeant Adams, it's our honor to have you here today, recognize you from the Downtown Columbus Rotary Club. We got a couple of things for you. Let me give you a Rotary coin. I know you know what to do with that. And then we have a passport for the arts with 2 tickets each to the River Center, the Columbus Symphony Orchestra, Columbus State University Theater Department, the Springer Opera House, and obviously our attractions here at the Infantry Museum, the theater, and our virtual reality simulators. All those things are closed right now. After COVID, they'll open back up, and we hope you have an opportunity to use those tickets. So thank you for being here.
Thank you. I appreciate it.
Sergeant First Class Adams, we thank you so much for your service and sacrifice for our country. We ask that you would extend our gratitude to the other men and women that served with you there at Fort Benning, and we hope that you will join us in person when we're able to get together so that we can meet you in person. We actually have a bonus soldier with us today that I want to introduce. We have joining me, you can slide in here. Notice we are wearing our masks and taking caution. But this is Staff Sergeant Reiner Huesler that's joining us today. Sergeant Huesler is going to give us a little bit of information about himself so that we can recognize him as well.
Yes, I'm Staff Sergeant Reiner Huesler. I'm stationed here at Fort Benning, also as my brother in arms in the 1st Security Force Assistance Brigade. Currently as an advisor, we deployed to advise foreign militaries to help stabilize their countries. So hopefully the American soldiers don't have to deploy as much in the future. I've been here for 5 years and I've been serving in the Army for 9 years.
Staff Sergeant Huesler, we thank you so much for your service to our nation. We have for you, on behalf of our club, a couple of gifts. This is a passport to the arts, which is 2 tickets each to the River Center, the Symphony, the Springer, the Columbus State Arts Program, and the National Infantry Museum. So we hope that you and your wife, Jamie, can use that and appreciate that. We also have for you here a challenge coin, and you know what to do with that. We appreciate all that you and the other men and women that serve with you down at Fort Benning are doing. So happy to have you here with us today.
Thank you very much, sir.
Thank you. So where folks can hear me. A few announcements to share with you today. There are several schools that have gone back to in-person classes this week, and we pray for the safety and welfare of the students, the parents and caregivers, the teachers, administrators, and all staff at the school. The decisions to return to in-person, whether or not to return to in-person instruction during pandemic is not been easy for anybody involved. And as a community, we just need to make sure that we're extending love and grace to all those that are involved in those decisions, and as we collectively work toward the common goal of educating and protecting our children. Also, announcement this week, I've told you for the past few weeks to put Thursday, August the 20th on your calendar. Well, now I can tell you what that's all about. Mary Reed, our own Mary, is turning 99 on August the 20th, and we want to celebrate that event with her. And so what we're going to be doing is having a drive-by birthday party. You guys have seen that with some of the younger children, maybe drive-by birthdays, drive-by graduations. Well, this is an opportunity for us to celebrate Mary in a socially distanced manner. We're going to have some treats for folks as they drive up and wish her well. And if my invitation alone is not enough to get you excited about participating in this event, here is a message from Mary herself.
I can't believe I'm nearly 99 years old, and I think it's so exciting that you all want to do a drive-in to wish me happy birthday. I really look forward to it and can't wait to see all of you.
Thank you so much, Mary. We look forward to celebrating with you. I'm particularly excited about our program today, as our speaker is someone that I have known since childhood. Cedric Hill is going to offer the introduction for us. And I'll call on Cedric now.
Good afternoon, President Joe and fellow Rotarians. It gives me great pleasure today to introduce Dr. Laura Adams, epidemiologist. As many of you know, epidemiology and epidemiologists are special in our home, and my daughter, Dr. Ashley Hill. But Dr. Adams is a veterinary epidemiologist with the Centers of Disease Control and Prevention, and is currently stationed in San Juan, Puerto Rico, working on the Dengue, Zika, and other vector-borne diseases. Before moving to Puerto Rico, she worked as a CDC field assignee at the Arizona Department of Health Services, where she led outbreak responses, coordinated infectious disease preparedness and response activities, and served as the Arizona State Public Health Veterinarian. She attended veterinary school at University of Georgia, is board certified in veterinary preventive medicine, and completed the CDC Epidemic Intelligence Service Fellowship. After vet school, she did a master's in public health program at UGA. She went from that to a fellowship at CDC called the Epidemic Intelligence Program, or EIS, where she was the EIS officer for 2 years. Dr. Adams also spent the past 3 months working in the CDC Emergency Operations Center as part of the COVID-19 response group. We welcome you, Dr. Adams, to Columbus, Georgia, and the Rotary Club of Columbus, Georgia, and we're very excited to hear your program today.
Thank you so much for the introduction, and I'm thrilled to be here. Let me see if I can share my screen. Okay, can you all confirm that you can see the presentation? Okay, I will take that as a yes.
We're not seeing your screen currently, Laura, but you can try, but just continue as you were.
Okay.
All right, it appears it's starting to work now. All right, yes. Looks like we've got your main page there.
Excellent. Okay, well, thanks again very much for the kind introduction. A quick disclaimer is that what I'm going to be talking about today are my opinions and don't necessarily represent the views of the Centers for Disease Control and Prevention. All right, I wanted to start with a little bit of background. As Joe mentioned, I'm a Georgia native. I grew up in Pickens County. Always wanted to be a veterinarian, but it wasn't until I was actually in veterinary school at UGA that I learned about careers in public health and epidemiology. And when I heard about it, I thought, that sounds like something I want to do, helping people, helping animals. And so I ended up doing a master's in public health, again, at the University of Georgia. And I'd like to talk to you a little bit today about some of the outbreaks I've worked on and lessons learned, and then talk in a bit more detail about COVID specifically at the end. So it wasn't until I got into vet school that I learned about One Health, which is the idea that the health of people is connected to the health of animals in our shared environment. As you know, there's a lot of contact or overlap between humans, animals, and the environment. And One Health is about considering those interconnections and how we can best protect the health of all three groups. And in particular, more than half of all infections that people can get are zoonotic, which means they can spread between animals and people. There are a lot of zoonotic diseases that you're probably already familiar with, things like rabies, salmonella, and E. coli. However, about an even higher proportion, about 60 to 75% of new or emerging diseases have an animal origin or reservoir. And the actually currently available evidence indicates that COVID-19 likely originated from bats, adding another one to that list. So I did want to mention briefly the CDC Epidemic Intelligence Service Program, which is a 2-year postgraduate experience and on-the-job training in applied epidemiology. And the mission of this program is to provide epidemiologic assistance, prevent and control disease and injury, promote health, and build capacity. And EIS officers work a lot of different places, including nationally within different groups at the CDC in Atlanta, also within state and local health departments, and also internationally and support ministries of health in other countries. So my assignment, I got into EIS, and if you know any young people who might be interested in this program, I'd love to talk to them anytime, but I ended up being assigned to the state of Arizona. And one of the projects that I spent a lot of time working on while I was out there is Rocky Mountain Spotted Fever, or RMSF. And this is a bacterial illness caused by the bite of an infected tick. You can see an example of the little tick at the top right of the screen. And unfortunately, this disease, or this bacteria causes disease in both humans and dogs. And the tick that was spreading this illness in Arizona was the brown dog tick. It was a new disease in Arizona in 2003, and almost all of the cases had occurred on tribal lands. And this is a very serious illness. It can actually be fatal within 8 days of when symptoms start if it's not treated correctly. And you can see an example of the spotted rash in the picture on the bottom right. The one good thing is that this disease is very treatable with the antibiotic doxycycline as long as it's given early in the course of illness. So I arrived in Arizona in 2012, and this is right after we had seen a big spike in cases in 2011 and a high number of cases at the beginning of 2012. And we had both seen numbers increasing as well as spread to new parts of the state in Arizona. The epidemiology of Rocky Mountain spotted fever in Arizona looked very different from what cases looked like in the rest of the United States. So in Arizona, often the ticks were being found or acquired from people around the home, whereas in the rest of the US, it was out people who were hiking in the woods. The age of cases in Arizona, we were seeing a lot of cases among young children, whereas in the rest of the US, it tended to be adults. And then unfortunately in Arizona, we had a much higher proportion of cases that were just dying from the disease, whereas in the rest of the US, it was less than 1%. And what we found when we went out to investigate was that these ticks that were infected with bacteria were being spread by a large free-roaming dog population. And you can see in these pictures how young kids could be getting exposed to these ticks. Because Arizona is hot, and if you're outside, both kids and dogs ended up being in some of the same areas. You can see in the little shade under the house, and the dogs being right around these households. So, and it wasn't, again, I want to say it's not the dog's fault because they're also getting sick from this bacteria, unfortunately. We had a number of challenges that we faced in trying to address this problem. First was who would take responsibility for the free-roaming dogs, giving community education, since this was a new disease that hadn't been around for very long and a lot of people had not heard of it. We also had the challenge of educating healthcare providers because this disease looked a lot different in Arizona than it did in the rest of the US. And there's also a hesitancy to give the correct antibiotic to children because it could cause some dental staining. Although we did studies to show that it did not actually cause dental staining when given at the appropriate dosage. There was also some historical distrust of the US government when working with these tribes. And as always, there's limited resources. But we knew it was worth it. This was something we really wanted to take on. So in 2012, we started the RMSF Coalition, and this was really reaching out to stakeholders across the state, including the American Indian tribes, local and state health department, the CDC, all of the partners who had a role to play. And we started a program that was called the RMSF Rodeo. And I'm going to talk through some of the actions that we took. First, we started a dog registration and tick control program. So every dog got a collar with a numbered registration tag. And each dog also got a long-lasting tick collar that would keep ticks off of these dogs for 7 to 9 months. You can see a picture of it as one of my colleagues is putting the collar on there. And if the dogs lost their collar for whatever reason, we would provide them a new one. We also tried to reduce the tick burden in and around homes. So you can see the manual method of spraying some of these yards with a acaricide, which kills ticks, and then the much faster four-wheeler method shown on the right. We also set up free spay and neuter opportunities for people that if they wanted to have their dog neuters, they could have that done for free. And we made a lot of efforts with community education. So this slide shows a flyer that we would distribute to community members and at healthcare facilities, teaching people about the disease, how to look for symptoms, and how to protect themselves. We also worked closely with the clinicians and tried to work with them on how we could best manage these cases. So we developed diagnosis and treatment algorithms. We also were able to put reminders in the electronic medical record system to make sure that patients got the appropriate antibiotic at the right time, and worked with different local and state health departments to be able to safely transfer patients off tribal lands if needed and make sure that they stayed on the appropriate treatment protocol. We worked a lot in communication and collaboration. So we set up monthly work group meetings, separate ones for health education and animal control, and then brought all partners together for a statewide RMSF meeting. And you can see one of the outputs of that was the RMSF handbook that could be used by anybody working on RMSF across the state. So we had really great outcomes from this project. This is from the first year, although we continued this project annually. And the first figure on the top shows the decrease of ticks in the environment from when the project started to a few months later. There was a major drop. We also saw a sharp decrease in the number of dogs that had ticks that we could find on them. That's the figure on the bottom. And of course, both of those contributed to our real goal, which was to decrease the number of RMSF cases and deaths occurring. One kind of side benefit of this is we had a lot of increased communication and trust between tribal and public health partners that was then really helpful when responding to other types of disease outbreaks. So some of the lessons learned from this are that diseases are often very complex and require a sustained and multi-pronged approach for successful control. There's not often just one thing that you can do to stop a disease outbreak. And then the other really important part was how key partnership building was, and really identifying different stakeholders and identifying the strengths and resources that different parties can play. So I'm going to change gears a little bit here. Wanted to talk for a moment about the Ebola outbreak response. This was in Liberia in 2014. You can see the location of the country in the map on the left, and then my mission specifically was in Grand Bassa County, shown on the right. And what I was tasked to do while I was there was investigate Ebola cases in remote areas. And let me make sure the slides are catching up with me here. But you can see from these pictures what I mean by remote, in that often vehicles were not able to actually get to the villages where we were going. It involved dugout canoes and walking. So a lot of times the actual travel to get there would take 4 to 5 hours from the nearest village with hotels or places to stay. So we were working closely in case investigation and infection control. You can see this picture of taking a sample from a suspected Ebola case, and then also trying to bring in supplies such as hand washing stations in some places that did not have running water, and teach people about how to prevent spreading or stop spreading Ebola in the community. So a big part of this was also training community members about social mobilization, which was trying to teach people, okay, Ebola is real. Here are the actions you can take to protect yourself and protect your community. And also contact tracing, which was following up people who had contact with a positive case. There were quite a few challenges in working in this mission. First, all of the areas I was working in were very remote and difficult to access. There was very limited access to healthcare facilities or healthcare providers in terms of trying to arrange for care for suspected cases. There was also quite a bit of community suspicion and distrust, particularly the first time when we would go and make contact with these villages. That situation usually improved as we would go back, have consistent messages and really show that we were there to help and that we weren't there to, we didn't have any negative intentions at all. But in addition to the seriousness of the disease, it was also really tough because of the impact of the quarantines on trade. And this picture just shows what's normally a busy market and how, due to the Ebola outbreak, everything had been shut down and was really affecting people's livelihoods. So some of the lessons learned from the Ebola outbreak, I think are applicable still today, are that support from community leaders is absolutely crucial to an effective response. And unfortunately, misinformation can spread rapidly. This has happened, this happens even without the help of Facebook and Twitter. I think it's just something that can commonly occur, especially when there's new disease outbreaks. But this picture shows one of our team members talking to a group of community leaders about the sprayers that were used to decontaminate areas where suspected cases had been. And there were a lot of rumors going around that these were used to spread Ebola virus rather than to kill it. And so we worked closely with the community leaders to really bring that message of the truth of what we were doing with the sprayers and trying to keep people safe and kill the virus. So I'm going to jump into a little bit on COVID. I'm sure you've been hearing about this a lot lately, but I wanted to touch on a few points. First, as you know, it was first identified in Wuhan, China in December. It's caused by the virus SARS coronavirus 2. And early on in the outbreak, a lot of the people who were infected had reported exposure to a large seafood and live animal market. But as more and more cases were identified, more of those did not have any direct contact to the animal markets, indicating that there was actually direct person-to-person spread occurring. And the first case in the US was documented on January 21st. So there are a number of different types of human coronaviruses. Most of these cause mild upper respiratory tract illnesses or the common cold. But coronaviruses, there's several different types of them, and they can also occur in animals, which include camels, cattle, cats, and bats. And there are previous events where animal coronaviruses can infect people. And some examples of this are SARS and MERS in the past 10 to 15 years. But COVID-19, of course, is a new disease and caused by a new coronavirus that we have not previously seen before. A little about spread and symptoms. We believe that the virus spreads primarily through close contact between people, and that it's usually spread by respiratory droplets that can be produced when anybody is coughing, sneezing, talking, singing. Any of those activities can really put a lot of droplets up into the air and then go on to infect others. And one important point is that unfortunately COVID can be spread by people who are not showing any symptoms. So, you might not know if you could be spreading the virus, or someone you're talking to could actually be infectious, even though they feel completely fine. As we have seen, this virus is spreading very easily and very sustainably between people at this point. The current transmission studies have shown that the virus spreads more efficiently than influenza, but not quite as efficiently as measles, which is one of the most highly contagious viruses known to people. And also, we think the virus can be spread by touching an infected surface and then touching either mouth, nose, or eyes. You can see the list of symptoms here, and these usually appear just a few days after exposure, but can be up to 2 weeks. And as we have seen with disease severity, it can vary from either very mild illness to very severe illness and death, unfortunately. And you can see a list of the most common complications of severe COVID-19 on the right. So I'm going to take 1 minute to talk through the current situation with COVID-19. Looking nationally, as of this morning, there have been over 5 million cases reported, 162,000 deaths, and that comes to a rate of about 1,545 cases per 100,000 people. This is what's called an epidemic curve that shows the number of new cases reported each day by time. And you can see that after the first case was identified in January 22nd, there was a spike in March and April when those numbers decreased, but then showed a sharp increase again in late June and July. And it does look like those numbers are decreasing slightly now. We see a slightly different trend looking at COVID-19 deaths. There was the highest peak in March and April. Those numbers then decreased through June, and we have seen a slight uptick again through July, but those numbers seem to be plateauing out in recent weeks. Looking more specifically in Georgia, this shows the rate of COVID-19 cases per 100,000 people by county. And so since this controls for population size, you can see that in terms of rates, the counties in southern Georgia have had slightly higher rates than counties in northern Georgia. If we wanted to look by age group, you can see that COVID-19 cases in Georgia have reported among all ages, although the highest number is among people 18 to 29 years old. Looking at hospitalizations, we also see hospitalizations in all age groups. However, the highest number is in the older age groups of 40 to 49, 50 to 59, 60 to 69, and older. And looking at COVID-19 deaths, there is a pretty sharp increase in risk in older age groups, with the highest number of cases reported in people 80 and older. So looking at the county level briefly, just to say that there seemed to be the highest number of cases in early July, with the peaks occurring then, and it seems to have a slight decrease in the more recent weeks in August. And this figure shows the number of COVID-19 deaths. And sometimes reporting deaths does lag a little behind reporting cases. And so the number of deaths does seem to be increasing some in recent weeks, unfortunately. So about prevention, I'm sure you've heard these messages a lot, but I think the more we can share them, the better. So just a reminder to avoid touching your eyes, nose, and mouth, avoid close contact with others, and stay home as much as you can. If you can social distance, it's because of this risk of people spreading the virus before they know they're sick or have symptoms. It's better to keep space between yourself and others, ideally about 6 feet. And CDC does recommend wearing cloth face coverings in public settings or anytime that you're around people who don't live in your household. And the thing about masks is they're most effective when everybody is using them. So the more people who can wear masks in public, the less likely it would be to have continued spread of the virus. And just a quick reminder of after you wear your mask, be really careful to take it off, only using the ear loops or ties, and be really careful not to touch your eyes, nose, or mouth. And then after you take the mask off, just wash your hands immediately to make sure that you don't have any virus on your hands. So I know that I'm getting close to time, so just a few take-home points about all of this. Public health and epidemiology is a really challenging but extremely rewarding field to work in. I think that we could do more to talk to young people about public health, let them know that this is an available career path. So as I said, I'm always happy to talk to anybody who's interested to learn more about it. Disease outbreaks do often require a sustained and multifocal approach to handling them, and that can include either education, interventions, and policy. It usually involves a lot of different interventions to try to make a difference. And then I wanted to mention in particular to all of you Rotarians that I know you're leaders in your community and that you really play a crucial role in response success. People believe those who are trusted in their community, and you can play a big part in setting an example and helping share accurate information about the virus. And with that, I'm happy to take any questions. I like this example of remembering to cover both your mouth and your nose when wearing a mask.
All right. Hey, Dr. Laura, it's great to see you, and we are so appreciative of you spending time with us today. I imagine this has likely been a pretty busy time for an epidemiologist, and especially busy at the CDC. And you mentioned here in closing how rewarding of a field it is. Could you speak a little more to some of the unique rewarding experiences you've had during your time in this field?
Certainly. So, there's a lot of benefits to it. I think, first of all, just working in a field where you're just trying to help people. Our overall goal is to try to help people lead healthy lives and the best lives they can. So there's, even though we're doing these investigations, trying to figure out what's happening, it's always the diseases that are the bad guy, and the people are who we want to help and support and really make the world a better place however we can. So that's one piece, is just knowing that we're really fighting for a good cause. Also, it's really been wonderful to meet a lot of different partners. Public health is a very collaborative field, and so it's really an honor to get to work with a lot of different groups, both internationally and also at the state and local level. So I have really valued a lot of the partnerships and friendships I've made through this work.
Something about her Wi-Fi. We
I
appreciate
think I think that's a great point, and I think we're going to find more and more in a variety of industries that collaboration is really the future of many successful entities or enterprises. And can you speak a little bit more about some of those successful collaborations and partnerships that you've enjoyed personally?
Sure. A lot of times it's happening at the community level. So in the examples that I talked about in those slides, getting to know and work with the tribal nations was really an honor. There's more than 20 recognized American Indian tribes in Arizona, and it was amazing to get to work with them. Also, of course, industries in private industries and partnerships play a big role as well in helping provide either vaccines or the dog collars that I mentioned that help keep ticks off. There's a lot of groups that we work with that play really important roles. And, in the Ebola outbreak, it was getting to know the people in the local villages and really talk and work closely with the local leaders there. That really opened the door to be able to make a difference and get our messages across.
That's fantastic. Sorry, I received a message that there are tons of questions here, and for some reason I'm not seeing them on my Facebook feed. So give me just a moment. I want to refresh this feed and make sure I'm not missing anybody's questions here. It shouldn't take but just a second.
Laura, while Cam is looking for other questions, you mentioned the sort of the echo chamber of misinformation on social media. Do you see that as prevalently? You're in Puerto Rico right now. I know here in the United States, seems like everybody's got a Twitter handle or a Facebook account, and we see people just forwarding information without verification a good bit. And what would your suggestions be for trying to prevent that for folks, or what can we do as leaders in the community to be respectful for people, but point them in toward truth as they share information?
Absolutely. I think that people can have a hard time knowing where to look for accurate information, and at least from the public health perspective, if you want to know something about COVID, I would recommend going to your the CDC website has really accurate, timely information. The state and local health department websites have accurate information. Go to sources that that you can trust to be sure that it's what you're being told is science-based and accurate. There are lots of publications coming out now in the time of COVID, and if you're deciding to look at those, I would just encourage you to really read them carefully. There's a lot of characteristics in how to evaluate a study that's been published to look at how valid it is. But in general, if other studies are supporting it, and lots of other studies are finding the same information, that can be a good indicator that it's more likely to be true. But for most general questions, I would say look to those trusted sources of CDC and state and local websites for accurate information.
That's great. Thank you. I have the questions here loaded now. What percentage of positive determinations are asymptomatic?
In terms of what I think that's trying to get at what percent of positive cases are asymptomatic. Mm-hmm. That's something that we're still looking into, and I can't give you a set answer right now. We do know that a proportion of cases are asymptomatic, and that different proportions have been found in different studies that have been conducted. I don't want to give you a correct number now, but I'm happy to follow up later with some of the studies that what has been found in specific studies.
Great, thank you. I'm going to put these two questions together. what kind of increase do you think we can expect to see in the coming months? And what is your best estimate regarding when an effective vaccine may be available in the U.S.?
Thank you for the questions. I really am probably not the best person to answer those questions. There has been, I would refer you to other people to answer those types of questions. In terms of what spread could look like, I think it's very hard to predict, and it's going to depend a lot on the decisions people make in terms of social distancing and wearing masks between now and then.
Okay. Here's another question. Did epidemiologists see a pandemic like this coming? Did they see COVID coming? And should we be prepared for other potential pandemics?
Yeah, so I don't think anyone thought there's going to be a coronavirus outbreak. This is exactly what's going to happen. However, public health experts have been preparing for years for some sort of large respiratory outbreak that could spread easily between people, and knew that could have a serious public health and economic impact. So yes, that was something that we knew as a risk. It's happened in the past, the 1918 flu pandemic. And I think that we should continue to try to be more prepared for any type of outbreak going forward.
Okay. What are some specific differences between the 1918 strain and the current virus?
Right, so the 1918 pandemic was due to influenza, which is a different type of virus, and this is due to coronavirus. They are both transmitted through respiratory droplets, so there are some similarities in spread, but the main difference is that they are caused by different viruses.
Okay, wonderful. All right, well, thank you so much for your time again and your leadership in public health. And I think we all agree that we're leaning so heavily on experts such as yourself to keep us safe and to keep us informed and to continue the valuable research that's saving lives and preparing us for a safer future and a safer way to live. So we're grateful to you and for spending your time with us today. President Joe, I'll turn it back over to you.
Thank you, Cameron. And Laura, thank you so much. It's wonderful to have you presenting here with us. Pickens High is very well represented today at our Rotary meeting. And so glad to have you and host you and hope to have you talk with us again sometime in the future. It's our club's tradition and custom to honor our speaker by donating a children's book to our local public library. And we're happy to do that today in your honor. A book will be donated with your name to the Columbus Public Library. So we thank you again, and thank you for all the great work that you and your team are doing, as Cam said, to keep us safe. Keep the information coming, and we'll do our part to wear our masks and keep our distance. But we appreciate you. As we wrap up the meeting, I want to remind everybody that a replay of today's program will be available on Facebook immediately following the live broadcast. We'll also send a link for a YouTube replay out to our membership later on. Our program next week will be a celebration of women's rights as we commemorate the 100th anniversary of the 19th Amendment to the U.S. Constitution. So that will be a fantastic program, and I hope that you'll join us for that. We've got Thursday, August 20th, Mary's 99th birthday. Please put it on your calendar. More information will be forthcoming on that. Please continue to wear your mask, keep your distance, love your neighbor, serve others above yourself. Let's get to work.